Hi, everyone, and welcome to Your Healthy Dose. This is a podcast about current trends in healthcare, and I'm your host, Kim Douglas. I'm excited about today's episode. We are going to talk about your thyroid and why it plays an important role in our health and our well-being. So to help us understand the thyroid better, we have two amazing female doctors with us today. First is Dr. Rose Lynn, who is an endocrinologist here at St. John's, and next to her is Dr. Melanie Goldfarb, who is a professor of surgery at St. John's Cancer Institute, director for the Center for Endocrine Tumors and Disorders. Am I correct in saying all that?
Certainly, yes.
Yes. Good. All right. Well, welcome to both of you, and thank you both for being here. And I think this is a topic that all of a sudden everybody's talking about the thyroid. It's become like the most popular girl in school, I guess. Dr. Goldfarb, you and Dr. Lynn both treat the thyroid different ways. So can you talk about the differences between how an endocrinologist treats the thyroid and how a surgeon treats the thyroid?
Sure. So we are basically a dynamic duo team. Dr. Lynn does a lot of stuff with the hormones and how it works, and if it's functioning well, not well. And then I take over when you have, as I say, things and growths on your thyroid. And so I help figure out what that is and figure out how to treat that. So we work in tandem on different things.
Wonderful. You seem like a great team. So Dr. Lynn, let's start from the beginning. What exactly is the thyroid?
Right. So the thyroid is a gland that's located in your neck, and its primary function is to make hormone.
Okay.
So for anyone who is with us on video, I have a model here. So basically, if you were to take your fingers and bring them from the sides into the middle and have the fingers touching each other, like pinkies on the collarbone, let's say, you will feel some hardness there.
Yeah.
So that's going to be your windpipe, your trachea.
Yeah.
Those are the cartilage. And on top of that is this soft gland called the thyroid. Basically, if you think about putting two thumbs together, it might be similar to that in size. It's going to be soft, and if you're not practiced at feeling it, you may not notice. But some of what we do on exam is we have people take a swallow, drink a sip of water, and you can feel that thyroid gland move up and down in the neck. So again, it makes hormone. So T3 and T4 are those hormones. And you can run into conditions where it's either too much or too little, but the happy spot would be normal levels of hormone that really are regulators of a lot of different systems and processes in the body.
Sure, that makes so much sense. So what are some of the problems that can occur with your thyroid, and how do you diagnose your patients?
Yeah, so a lot of times when I have a patient coming in for a thyroid evaluation, we're talking about exactly what Melanie brought up, that we have structural problems or we may have function problems. And so the function, again, is to make thyroid hormone. And there are instances in which you can make too much thyroid hormone, and we call that hyperthyroidism.
Right.
Like a hyperactive kid, again, too much.
Yes.
Or oppositely, we could have too little thyroid hormone, and we'd call that hypothyroidism.
Got it. And those two are the differences, right?
Yes.
And are the symptoms the same of each?
No. So hyperthyroidism, again, we can think of it as there's too much stimulation, or I will talk to people who come in about, imagine if you had too much caffeine, like
You're
too much
preaching to the
caffeine.
choir.
Right. So you might feel nervous or jittery.
Right.
You might notice your anxiety is worse. You might get these really shaky hands and
Yeah.
tremors. Your heart may be beating faster. Other things that could happen with hyperthyroidism would be weight loss, because your metabolism is really sped up.
Yes, that's why some of us look at those women at the luncheons and they're eating, carbs and bread, and you're like, wait, if I ate that, is that what it is? Sometimes.
So, sometimes we could say, right, people will come in and say, well, I actually was doing a keto diet, and I thought it was because of my diet and exercise that I was losing weight. So not everybody with hyperthyroidism has the weight loss. And I have people who come in and say, but I haven't been losing any weight. What do you mean I'm hyperthyroid?
Yeah, exactly. And then the symptoms of hypothyroid.
So hypo is, I like this mnemonic of, not really a mnemonic, but hypo is like slow and low.
Of course.
So you can, in extreme cases, have the heart beating much slower than normal.
Okay.
You can actually have digestion affected, so you're having constipation and being less regular. You can even have depressed mood that's caused by hypothyroidism. weight gain can be associated with it, but it's generally not a huge weight gain. Something usually not more than 10 pounds, I would say, could be maybe attributed to having a slow thyroid.
That's significant. So what age should we begin thinking about our thyroid? And is there any certain demographic that's affected by an unhealthy thyroid more than another demographic?
So I would say, well, truly, newborn screening includes thyroid screening. So there are cases of babies born who are hypothyroid from birth. So that heel prick that babies get when they're born, it's a really important hormone. If you don't have hypothyroidism and you don't address it, especially from birth, there are really some unfortunate, very drastic consequences. Aside from birth, I think most of the time we don't really start looking at the thyroid until we're really adults. But in children, if there's abnormal growth or puberty is not going correctly, that's something that a pediatric endocrinologist might screen for. So myself, I only see adults.
Yeah.
But it's something that I would say once you're starting to see your doctor regularly, or maybe even if you're 20s, go ahead and get it checked, thyroid hormone levels, and have a physical exam. And if it's normal, you may not need it really on an every year basis unless you have risk factors.
So what are some of the causes on why the thyroid does go out of balance?
Right. So I mentioned one, which is congenital. Again,
Yes.
Unfortunately, some babies are born with it. Other most common cause, I would say, is autoimmune. So your body makes what we call autoantibodies. Generally, your antibodies fight infection like bacteria or viruses, but you can generate also autoantibodies that target things that are normal to our bodies. The thyroid can be a target. So you can actually have antibodies which target the thyroid and increase the likelihood that somebody will become hypothyroid. It's a condition we call Hashimoto's thyroiditis. Oppositely, we have other antibodies that will stimulate the thyroid, and that can cause hyperthyroidism or Graves' disease.
Interesting. And we've heard both of those terms numerous times, So why is it so important to get treatment then for your thyroid, and what options are available?
So you may not feel well if your thyroid hormone is out of whack. If it's too high, we just talked about it can feel like you have too much caffeine and you're nervous and heart beating rapidly all the time and just not feeling well. Hyperthyroidism, if it's pretty severe or not treated, it can also increase the likelihood of poor bone health, so development of osteoporosis or even development of atrial fibrillation, which is irregular heartbeat, and that's pretty severe and dangerous. So you definitely want to have that evaluated and treated if it's identified. As for hypothyroidism, there's less, let's say, acute health risks like we have with hyperthyroidism. But again, you may feel poorly. Your cholesterol actually may be a little bit worse if you're severely hypothyroid. Your brain may have kind of what we call brain fog. Sometimes your thinking is just not as sharp when you're hypothyroid. So you're just not in optimal health.
And so the treatment for...
So treatment, right. Pretty much medications are one mainstay of treatment. So if you are hypothyroid and you don't make enough thyroid hormone, thankfully we have thyroid hormone. Comes in pill forms, gel caps, liquids even for children if needed. If you have too much thyroid hormone, then we use thyroid blocking medications, which will slow down the function of the thyroid gland so that we can normalize your levels.
Makes sense. And then how about maintaining a healthy diet? Does that ensure for all of us that we're going to have a healthy thyroid?
Not necessarily, unfortunately. So a lot of these autoimmune conditions may take over.
Right.
And diet will not really affect that. So I think there's a lot of information out there, and maybe I'll mention a few of these things that people may ask about. So there are certain vegetables and fruits that are considered goitrogens. They may have some interference with thyroid hormone production in the sense of affecting iodine metabolism. But truly, these are healthy foods. So kale, broccoli, cauliflower, peaches, right? Soy. And I think most people eat fairly balanced diets that they're not really eating that one particular food in such a large amount, or that category of food in such a large amount that it would cause a problem. So I generally don't tell people to restrict these foods, and I don't tell them to necessarily take more of it, just eat a healthy, balanced diet.
Well, I'm going to just change that around and say I cannot eat kale anymore because Dr. Lynn said not to. That's going to be wrong, right? Okay.
Correct.
Well, you can't help. I just never got into kale, I got to tell you. So that's
okay.
a good thing.
Yeah.
Well, thank you you for all of that. Such good information. Let's move on over to Dr. Goldfarb and let's transition to cancer. So how common is thyroid cancer and how is that detected?
Sure. So thyroid cancer is not necessarily your number one cancer out there for older people. Interestingly enough, in the young adult group, so we say in the 15 to 40-year-old group, it's actually the number one cancer in young women. It's actually overtaken breast in their 30s. So it's still rare, but in that age group, it's actually the number one.
Wow.
Yeah. But it also is one of the most cancers that has the highest rate of increase lately over the past couple decades. And there's questions of if it's real or if it's not. So we talk about some of it's probably we're detecting it more, but some of it's also real, which we don't really understand why.
That's interesting. And then talk to us about the other options that are available to treat thyroid cancer besides going into surgery.
So what we always say is that thyroid cancer is a surgical disease in general. There's really no medical treatment for it. And in a good way, you really don't have to have chemo. You don't have to have radiation. And so the way to treat it is to take it out and do surgery. It's a pretty easy outpatient surgery for most patients. Now, there are some patients that have more advanced cancer, so we may need to do a little bit more. Yeah. But most patients, outpatient, take it out, you're done. That's it. For very small cancers these days, almost like these incidental little tiny dots, we can actually watch them kind of like you watch baby prostate cancers. And we call active surveillance. And you come and you get regular ultrasound screenings to make sure it hasn't grown. But we're choosing not to operate on some of these really tiny things.
That makes sense. And obviously, then we can survive without the thyroid if you take it out, right?
If you take it out, then we put you on medicine like Dr. Lynn talked about. And you really shouldn't skip a beat. You know, sometimes it takes a little bit, just like if you were you're basically hypothyroid. So now you become someone without hormone. And sometimes it can take a little bit of time to adjust you to the right dose. But yeah, now we have great hormone. I tell patients I relate it to insulin for diabetics. So you're not going to have side effects. It's not something that's foreign to your body. We're just replacing what your body normally makes.
That's really interesting. So is there a certain demographic that's more at risk to developing thyroid cancer than another?
So even though I talked about the young adults, really the most common age is middle-aged women. So we talk about in their 50s, nodules themselves. So how do we detect cancer? If somebody has a nodule. Nodules are pretty common, especially as we get older. So in postmenopausal women, I say 60 to 70% actually have nodules, and most don't know it. Even in our age women, probably about 40% have them, and that's where cancer would come from, grow in one of those nodules.
Interesting. So can both of you talk about what kind of innovations are on the horizon to treat thyroid cancer?
Sure. So I'll
or
talk.
the thyroid in general.
Yeah. So I don't know if there's too much innovations from a medical
I would
standpoint.
agree with that. Yeah.
So I think when people ask what's on the horizon for thyroid, I'll talk about two things. One is diagnosis of thyroid cancer and who to treat. So we have a bunch of molecular tests. You used to, if you did a biopsy and you got a questionable biopsy, everybody went to surgery. We don't want to do that. So now we have more tests and they're good, but they can get better. So we're still coming up with better tests to figure out who actually has cancer and then who's going to be a bad actor. So maybe we don't need to treat everybody someday. So that's number one for cancer. Number two, something that I actually started here about 1.5 years ago is something called radio frequency ablation for thyroid nodules. So so Dr. Lynn showed you what a normal thyroid looks like. Sometimes you can get growths that are like this big, that big, but they're actually not cancer. And so the only way we used to be able to treat it is to take them to surgery. But now they can come to my office and I sit and I tell them I'm zapping them, but I do this thing where I ablate their thyroid and I shrink it.
Wow.
So it's a great non-invasive option that has really been helping so many people out there that otherwise would have needed surgery.
Any way you could zap, just kidding. I have this one roll around my waist, just kidding. Well, let's go into talking about both of you two personally. So I understand that both of you had some interesting aspirations before you got into this or when you were younger? Tell me about what you wanted to be or do.
I go first.
Sure. Well, when I was a kid, I loved kind of stories and watching things and reading things. So at one point, I thought about, I want to be an actress when I grow up.
Oh,
I took singing lessons. We did local theater. That was a lot of fun when I was a
we
kid.
have an agent, right? No, just kidding. But you're lovely. And what else were you saying about what you wanted to do?
Oh, as I got into college, I remember I wanted to be a college professor as well. And that's kind of really where I developed this love of science and learning about DNA. And it's so investigative to be in medicine.
Yes.
Someone comes and you try to puzzle and figure it out. So I think of it as like you're doing detective work.
That's great. I love it. And how about you?
Okay, well, I definitely was not going to try to be an actress. That is so not on my thing. But I really wanted to be an astronaut. I wanted to build spaceships and fly them. I like all that stuff. And then as I got older, I also wanted to be Scully, from the X-Files. But all those things.
Yeah. How did you get?
Made me, when, you figure it out, you do like internships. And I was sitting in front of a computer or like whatever. And I'm a people person. And so then I sort of realized that and realized doing surgery could let me do a lot of stuff with my hands and build and be creative and artistic, but let me talk to people and not sit in a dark room all day.
Exactly. So what makes St. John's such a special place for you two, not just as doctors, but for your patients?
So what I would say, and I was just with a group of other women doctors last night, and we talked about it. You can call up and a referring doctor would call me and say, you know what, I have a patient, they just got diagnosed with this. So instead of waiting 6-8 weeks to get in with somebody, we'll be like, great, bring them in tomorrow. So it's a very close-knit community of doctors who work together, where you feel like you're being treated in like a mom and pop shop as opposed to being lost in a big system. So even though like Dr. Lynn can be hard to get into, but I'll just call her and be like, hey, you need to see my patient. And she'll be like, fine, I'll see them right away. So it's a really nice community that works together. And it's all people that really were at the top of their field, but decided they didn't want to deal with some of the big systems and wanted to be in a different place.
Yeah, so I have to agree with Melanie with the use of the word community, also collegiality. It really is a smaller community where we actually all know each other in terms of who we're referring to. When I first started here, I remember walking through the hospital and looking at someone and thinking, I think I know that person. Let me get closer and see their name badge because the face looks familiar. But we all really do on a regular basis interact. And so we know who we're referring to. It's wonderful.
It really is. And it does. It feels so much like a community. As a patient, I really felt that. So we're just about getting to the end of our show, unfortunately. So I want to ask you both, is there any one thing that our listeners should take away from this discussion?
I think to be aware of a lot of information about the thyroid may not necessarily be something that you have to follow, like avoid these foods, eat those foods, you have to do this or that. I think the main thing I would say is have a relationship with your physician and talk to them about, should you get tested? Should you have an exam of your neck? And just listen to your physician and take their advice.
Great advice. Anything you want to add?
I'm going to agree with Rose, and this is not stuff we talked about that much, is there's a lot of stuff on Dr. Google, right? So we all have patients come in who are like, I did all my research, I know what's going on and so forth. And I think really like what Dr. Lynn said, if you have concerns and questions, talk to your doctor about it. They'll know if you need to see one of us. And the thyroid is more, you're not going to do things in your everyday life that is going to affect it, but it can really, if you do have a problem, whether it's like structural or hormone, getting treatment is really going to make a difference for you in your everyday life.
Absolutely. Great advice. For more information on your thyroid, please visit the St. John's Endocrine website at www.stjohnscancer.org/endocrine. I had the best time with you too. I don't want you to leave and become an actress, and I don't want you to fly out of here and become an astronaut. We're so glad that you're right here at St. John's and we can find you both. So thank you for being here and being with us today on the show.
Thanks for having
Thank you.
us.
It's really great. And thank you to St. John's Health Center Foundation and the many friends of the foundation for making this podcast possible. We also want to thank you all for joining us today. I invite you to tune into our future podcasts because we have more medical experts like the ones we had today at St. John's joining us to share their special insights about a number of important topics. And if you missed any of the previous episodes, please visit yourhealthydose.org and you can see them all there. Until next time, I'm Kim Douglas with your Healthy Dose.